research shows that women receive inferior care. Doctors are more likely to misdiagnose women compared to men. Any pain that's interfering with your quality of life, go speak to your GP.
Today, I'm joined by Dr Hazel Wallace, who you might know as the food medic. She's a medical doctor, nutritionist, Sunday Times bestselling author, and one of the most trusted voices in women's health right now.
Pill and hormonophobia is wild at the moment. I think we need to be really careful that we're not fear-mongering unnecessarily when we don't have the evidence to back it up.
Why do I sometimes look at myself in the mirror and hate what I see?
So a big reason is because we are letting young girls down from their very first period because we're not educating them. If men had periods, the campaigns around period products would be like really powerful. The evidence for cycle syncing is just not there. A term I prefer is being cycle aware.
What should we expect when we come off the pill?
Really good question. I've actually changed my mind on this topic.
Hello everyone and welcome back to Vision of Health, the podcast where I talk to qualified experts about what being healthy really looks like in everyday life and how your daily habits can help you feel well today whilst also protecting your long-term health. I'm Dr Frankie, I'm a medical doctor specialising in cancer research, and my mission is to bridge the gap between the science and real life, helping you make sense of the evidence in a realistic and sustainable way without falling victim to trends and fads. So whether we're talking about nutrition, sleep, gut health, movement, mental health or longevity, this podcast is here to help you build your vision of health. I'm Dr Frankie and this is my Vision of Health. Every month, millions of women lose days of energy, focus and productivity due to their periods. And it's because symptoms like pain, heavy bleeding and fatigue are treated as something that we just need to push through, rather than symptoms we should learn to understand and manage. At the same time, social media is full of advice on cycle syncing, hormone balancing and period hacks, very little of which is grounded in good data. Today, I'm joined by Dr Hazel Wallace, who you might know as the food medic. She's a medical doctor, nutritionist, Sunday Times bestselling author, and one of the most trusted voices in women's health right now. In her new book, Not Just a Period, she brings together menstrual physiology, nutrition science, and lifestyle medicine to help you work with your period, to show you how your cycle can act as your monthly report card on your overall health, and how to work with your hormones for better periods, more energy, and a healthier you. If you've ever been told it's just your hormones or period pains are normal, then this episode is for you. Dr Hazel Wallace, welcome to Vision of Health.
Thanks for having me.
Thank you for coming here. I'm obsessed with everything you put out there.
Well, thank you.
And loads of people listening online will be really familiar with your work as the food medic. But over the recent years, you have kind of transitioned more into women's health. Can you talk us through that evolution and the work that you do now?
Yeah, so I am quite a dinosaur online. I started social media 14 years ago now, which is crazy to think. It feels like it's been 2 years. But in the beginning, I started under the handle The Food Medic, which was a brand I started originally as a blog, like a very simple WordPress blog, essentially translating the link between nutrition and our health. And as you know, as doctors, you don't learn very much at med school, but I was really interested in this area of our health and medicine. And I guess as my backstory, I lost my father to a stroke when I was 14. And while I was really young at that time, first of all, that experience made me want to be a doctor. And second of all, I started to realize that our health is also shaped by our nutrition, our stress levels, our physical activity levels. And was really excited to learn all about this in med school and learned absolutely nothing. So I went on to do a master's in nutrition. And so the Food Medic has been going since then. It still exists today, although I have separated myself slightly and I have a really great team and we run that together. But around the pandemic time, I'd say like 2020, I really started to pivot into women's health. And I guess during that time, while working as a COVID doctor, I was also living alone. So I was spending a lot of time on my own reading outside of clinical hours. And there was more and more research coming out about how women have been neglected in health and healthcare and how most of the medical research we have today is based on women. And I'm not sure about you, but that was complete news to me. So during that time, I wrote my first women's health book, The Female Factor, highlighting this issue and basically laying out about how women are not small men and how when it comes to nutrition, exercise, sleep, stress, our health is shaped very differently compared to men. And part of this is biology and part of this is bias in the world that we live in. And since then, I've really just pivoted into women's health. So nutrition is still part of what I do, but women's health is the main focus.
I think it's incredible. And I think I've been following since the beginning, by the way. But I think one thing I just really want to say is that for so many doctors, you have encouraged us to have those conversations about lifestyle medicine, to talk about diet to your patients, to talk about exercise. So even though we often quantify things by, followers online or how many books you sell and things like that, or how many podcast downloads you get, there are so many patients that have been benefited from you inspiring doctors.
Thank you.
So thank you for everything that you've done. You touched on there that women's health has been under-researched and underfunded for decades. And I've definitely seen that. I work in cancer clinical trials. And the stat is that up until 1993, we didn't trial drugs on women, which is absolutely fascinating because so many drugs that we use day to day, like paracetamol, that means they were never tested in women. Why do you think that this is?
So a big reason is because we have fluctuating hormones with our menstrual cycle. And for a researcher, that is just considered quite a nuisance because it's really hard to control for a stable environment. But with men, it's really stable. So that's a big reason. The second reason, especially when it comes to pharmacology and drugs, is because the risk of pregnancy in women of childbearing age. And then the third reason, which is unrelated to our hormones, is historically, women have been primary caregivers, and simply recruiting women for trials was difficult because they would happen during work hours or, at very inconvenient times. And so essentially, this all boils down to we excluded women for those reasons. And it's only up until recently that we started including them and having to include them as well. So while a lot of this research is based pre-90s, as you know, it takes a long time for that to be integrated into guidelines, then integrated into our practice, and then to reverse all of that and change things requires so much effort. So even though we now have a lot more research on women, I think it will take time for that to trickle down into how we practice, which is really frustrating because it means that a lot of what we do when it comes to women in general health and medicine, but also women's health, is left up to guesswork.
According to the British Heart Foundation, women are twice as likely to die from a heart attack as men. And I think it's that 8,000 additional lives could have been saved if a woman received the same care as a man in the emergency department. You spent a long time really delving into these gender health inequalities. Can you share some of your discoveries that shocked you the most?
Yeah, I think the heart attack and heart disease stats are really shocking. And it's great that the British Heart Foundation actually published those because it was basically shining a light on a problem that is really big in the UK, in England and Wales. And I think a lot of the narrative is that men get heart disease and not women. And if you think about any public health campaigns, it's usually older white man, grey hair clutching his chest. So you just don't see women in that kind of narrative in those adverts. But when it comes to at every stage of the process, from symptom onset to discharge and rehabilitation afterwards, research shows that women receive inferior care. And when we disentangle all of this, some of it is down to our biology, in that we may present with slightly different symptoms. Now, it's not true to say women have these symptoms and men have these symptoms. For everyone, the most common symptom is, central crushing chest pain. But women are more likely to get pain during between the shoulder blades, for example, or symptoms that are very similar to indigestion or nausea. And so at that point, when you're having symptoms, you might think, oh, I'll just treat it at home. And actually research shows that women try to self-medicate. They put off going to the hospital and they're less likely to think that it's actually a heart attack. So they attribute it to something else, anxiety, stress, whatever it might be. Whether that is something that's within us or whether that's society shaping that we are anxious individuals and we don't have heart attacks, I'm not sure. But even when we get to the hospital, doctors are more likely to misdiagnose women compared to men with something else. And more often than not, it's with something that's a psychological diagnosis versus a heart attack. And when it comes to heart attacks, as we say in medicine, time is muscle. So we need to reperfuse the heart as quick as possible. So any tiny delay has massive implications. And so this is why women are more likely to die from heart attacks in the UK than men. And even when it comes to rehabilitation, there's research to say that women are less likely to be referred for it afterwards. And that increases your risk of having a second event later in life. So it's so eerie as a woman to read those stats, and shocking also as a health professional to think, well, why did no one mention this in lectures? You know, in any of my cardiology placements, this was never brought up, and none of this research is that new. So it's only now that we're really talking about it. And I think from speaking to some doctors working in that space, I think guidelines will change. I think we'll be looking at like sex-specific markers when it comes to certain things. But yeah, take-home message is if you ever have any new chest pain that doesn't go away on rest, regardless if you're a man or a woman or whatever age you are, please go to the hospital.
Absolutely, and advocate for your pain. Because I think if you think about our menstrual cramps, essentially it's like ischemic pain. It's lack of blood supply to the uterus muscle, right?
Yeah.
So we're used to feeling pain similar to a heart attack.
Yes.
Every single month. And so I wonder if also women downplay their pain because they're used to having pain monthly.
Yeah.
And we're just kind of taught to just get on with it.
Yeah, potentially.
Interesting. Many of us are good at spotting red flags in a relationship, but are not so good at spotting red flags in our own menstrual cycle. What are the key menstrual red flags that you want people to recognize early?
I think following on from what you said, period pain, that is something that we have been brought up to believe is just part and parcel of being a woman. And I think pain is obviously very difficult to quantify. It's very subjective. So there's no scale for it needs to be 10 out of 10 pain before you actually ask for help. Any pain that's interfering with your quality of life, making you miss school, university or work, you're on the floor, you're nauseous, you're sick, you're taking time off, that's severe enough for you to go speak to your GP. So it's anything that's significant enough that you can't handle. That's a big one. And sometimes we don't know what the cause is for your pain. Sometimes period pain is just period pain. But sometimes it's due to something underlying like endometriosis, adenomyosis, fibroids, whatever it might be. And there are treatment options for those. So please don't sit in silence. That would be the main thing. Heavy periods is another big one. Again, really difficult to quantify. And if you look in the guidelines, it will say more than 80 mils or half a teacup. But like,
what does 80 mils even look like?
Who's measuring that? Unless you've got like a moon cup or a menstrual cup, even that's really difficult to quantify. Yeah. So again, if it's too difficult for you to manage, if you're leaking through, if you're soaking through, if you're, you know, having to use 2 period products at once, that's a bit of a red flag. So speak to your GP. There are things available. Bleeding when you shouldn't bleed. Sometimes you might have spotting and occasionally that can be normal, especially around your period. But if it's happening a lot throughout the cycle, we want to know about it. If it's happening after sex, we want to know about it. And after the menopause, which is kind of unrelated to this, but good for people to know. And then the other thing to mention is how regular your cycles are. And I often am quite surprised with how many women don't really know what their cycle length is. I think more and more we're talking about it online with our friendship groups. So more women are using these apps, and apps make it so easy to track that. But even the simple, I don't think it's like often explained how to track your cycle. So day one is day one of your period, and then the final day of your cycle is the final day before your next period, and that's how we track it. And anything in the UK, we say anything between 21 to 35 days, it's normal. So that's one thing to look out for. If you are constantly getting irregular cycles or they disappear, a red flag. And finally, one that's often not mentioned, I think is really important to mention, is if you get really disturbed mood before your period. Now, it's normal to feel a bit tearful and emotional, but like really low mood where you can't get out of bed, you feel so depressed, you feel so low, it impacts your relationships, which happen for a lot of women. That could be a sign that something else is going on, be that PMS or PMDD. And again, there are people there to help, so speak to your GP.
Great advice. I read in your book that period-related symptoms like pain or heavy bleeding causes 9 days of productivity loss for women each year. What can we do about this?
Yeah, I mean, I think that's such a shocking stat. And I guess the primary thing to think about is if we are able to manage those symptoms and understand what the underlying cause is, we'll be able to reduce the symptom load, and hopefully that would improve productivity. I think the other thing is we don't really have workplaces set up to support women who are experiencing any issues like that. And from releasing a book on periods, I can tell you that the topic itself is so taboo. Even though I think in spaces of women's health we're making progress, menstrual cycles in general, periods in general, have been completely neglected from workspaces. Now we're seeing menopause initiatives, but we've yet to see that for menstrual health. So I think more support from employers, but also we need more support for women who are experiencing those symptoms as well.
I would feel really reluctant, I guess, if I needed to call in sick because of period pains or heavy bleeding, to share that with my employer. I would probably make up something else. Or I probably wouldn't call in sick and I would just battle through, which is wrong.
Yeah, it's really interesting because for this book, we did a research survey through social media, and we found that a lot of women who take days off are using unpaid leave and annual leave because they don't want to use sick days or be honest about what they're experiencing. So even that in itself, like how that's impacting our quality of life, our ability to take holidays, is really sad.
I think it all is also embedded with the judgment that women feel they're going to get as well about maternity leave.
Yeah.
Like lots of women are scared to plan their maternity or to tell their employer because it's like makes them a less desirable candidate, which is so wrong, but I think it still does exist.
Yeah.
And so for the same reason, I imagine lots of women are really worried about looking weak by having to take time off for their menstrual symptoms.
Yeah, I think so. There's a big conversation around menstrual leave now, which we don't have in the UK, but some countries have it, like Spain. You know, a group of people think this is actually going to further stigmatize women. Another group of people think this is actually going to really help women who have really debilitating symptoms, because if you could take a few days off every month or work from home or have some kind of reasonable adjustment, then you might be more productive because you're actually at home with your hot water bottle and your painkillers and you can just crack on.
Yeah.
But if you are someone who's taking that leave, will you be further stigmatized? We don't know. And I think I'm always asked that question. I don't know what the right answer is. I think it's important that we kind of watch and learn from countries that are doing that, because we don't want to further create a bigger taboo around the topic either.
I mean, I guess the right answer is ultimately, I hope we get to a place where women that are having these extreme symptoms are better managed. Like we know more about the conditions that are causing these symptoms in the first place and can manage them better to prevent them being in that position. But yeah, that's so interesting about Spain. I also love that Spain are really encouraging in the summer of going to the beach.
Yeah.
I work with a lot of people in Spain on clinical trials, and you get like an out of office reply like, sorry, not replying in August, we're at the beach. It's amazing. They're really leading the way. I want to move now on to how we can work with our cycle and our hormones. I want to obviously talk a little bit about nutrition. In the book, you talk about tailoring your nutrition across the menstrual cycle. How do our nutritional needs vary across our cycle?
Yeah, so I love this topic. Obviously, nutrition is my bread and butter, but I think it's so fascinating how nutrition can influence your cycle and your symptoms, but also how our cycle and our hormones can influence nutrition and what we eat. So I'll start with that, because across our menstrual cycle, and kind of so we're all on the same page, let's say textbook 28-day cycle, follicular phase is the first half of the cycle, luteal phase is the second half, with ovulation in between. And what we see at the start of the menstrual cycle, so when you're bleeding, that is a very pro-inflammatory state. Your body is producing lots of inflammatory markers. It's controlled inflammation. It's normal. It lets your body heal. But naturally, that will come with redness, heat, swelling, pain. And so there is a suggestion that having anti-inflammatory foods during that time can be helpful, because we want to dial down that inflammation. What I mean by that is your colourful fruits and veg, your nuts and seeds, your oily fish that are rich in omega-3, and reducing things like alcohol, caffeine, that kind of thing. Because the prostaglandins that are released from your womb that help your womb lining shed, they can also act on the nearby gut. So oftentimes people get looser stool during that time, or period poops, which is the term that the girls use online. So being conscious of that, maybe now's the time not for fried or fatty foods. Even like sugar-free gums can impact it, fizzy drinks, and thinking about getting mostly whole foods from your diet, having fiber. But if you're really struggling with that, you might want to bring back the fiber for a few days and just stay really well hydrated. Then we move into the kind of late follicular phase. Estrogen comes up, and oftentimes women report that their appetite's slightly lower during that time. They're a bit more energetic. And so no real changes to nutrition during that time, but because we've lost some iron through blood, we might want to top up our stores then and be conscious of that. But ideally throughout the month in general. But where things get really interesting is in the luteal phase, where women report higher cravings and food intake during that time. So studies show that women might eat an extra 300 calories per day in the luteal phase. And this is partly because our metabolic rate, or the amount of calories we use at rest, is slightly higher. It's actually not as big as people think, but is slightly higher. And so that's driving up your appetite. And progesterone is quite appetite stimulating, whereas estrogen does the opposite. So if you're feeling that, and also your sleep tends to be off during that time, you might be PMSing. You clearly just want to reach for chocolate, and that's absolutely fine. But you might want to think about regular balanced meals, getting your protein in. Fiber is incredibly important because we have the opposite problem than we do during our period, where progesterone slows down gut motility. So you're feeling more bloated, more constipated. So fiber is your best friend during that time. And that's really kind of it in a nutshell. Whistle stop tour.
I'm obsessed with the term PMSing.
Yeah.
I'm going to use that now. I'm going to say I'm PMSing. Is there good evidence that diet can improve menstrual symptoms like period pain? PMS?
Yeah, there is. So most of it's supplement trials, but like I mentioned, anti-inflammatory diet's the best kind of place to start. And a type of diet that would fit into that category would be a Mediterranean style diet. So there's research to suggest that a Mediterranean style diet can reduce endometriosis associated pain, but can be helpful for things like PCOS or PMOS now. And then certain nutrients in particular have been researched for period pain, or what we call dysmenorrhea. Omega-3 is one of the best ones, I would say, omega-3, and those supplement trials where they compare that to anti-inflammatory medications like ibuprofen, and it's quite effective. So if you don't have oily fish in your diet, I would definitely consider adding that in, regardless if you've period pain or not, because oily fish is your best source of omega-3s. Then some evidence for calcium, magnesium, and zinc to a lesser extent. And some of the trials are, you take it in the second half of your cycle, pre your period coming. So there are a few you can try, but I always would say try optimize your diet first before getting into supplements. They're not regulated in the way we regulate medicines. You can take too much of a good thing. And I'm a big believer in food first, and you get so many other benefits from the food, the individual food, than you would from a capsule.
Absolutely. And even then, when you're talking about the oily fish, there's so many other benefits for our skin and our heart health and everything as well. It's all interchangeable and interconnected, isn't it? What about exercise? We see a lot about people talking about cycle syncing and being very prescriptive with workouts. How might our menstrual cycle impact our performance, recovery, or perceived effort when we exercise?
I've actually changed my mind on this topic. A couple of years ago, when I first started researching in this area, I felt like the evidence supporting your menstrual cycle impacting performance and recovery really validating for me, because I'm someone who really feels the effects of that. And so it made a lot of sense to me. But I think at this point, we now have modest amount of evidence to say that exercise may be impacted by your menstrual cycle and your hormones, but to a very small degree, and it's very different between women. And so I think the evidence for cycle syncing is just not there. Like, while you may feel like on a given day that your PMS symptoms or your period cramps or just your fatigue from not really sleeping very well because it's post-ovulation and you don't sleep well during that time, if that's impacting your cycle, then, or if that's impacting your exercise, then of course we can see those true effects. But when it comes to the actual impacts of the hormones on a physiological level, they're small. So I don't think they're big enough for us to say, oh, this week you need to do HIIT exercise and this week you need to do yoga. That said, I think a term I prefer is being cycle aware.
Yeah.
And so tracking your cycle, and know if you're someone like me who feels, I feel the worst the week before my period.
Me too.
I feel bloated, heavy. I don't want to exercise. I will not do my longest, hardest runs or workouts during that time. I will be intentional to still move my body, but in ways that I enjoy, but not because a program is telling me I can't. Because, you know, I work with a lot of women who are high performing, active women, and some of them feel amazing all month long. So why should I tell them, do not do any high intensity exercise during this month, when there's no evidence to say that's going to impact them? And actually, there's good evidence to say that exercise can be really beneficial for improving period pain, and regular exercise can be really beneficial for PMS. So ideally, we want to be active all month long.
Yeah. I mean, I love what you said there about being cycle aware, because there's a little bit of science to say that in the follicular phase when estrogen's higher, we make more strength gains, or we recover quicker, or in the follicular phase when progesterone's higher, we may take longer to recover. Okay, there are some studies that show that. But what I like about that is that it just allows people to cut themselves some slack.
Yeah.
So if you show up to the gym and everything feels heavy, or you start your Garmin and your run feels really hard, I like that it allows us to think, okay, maybe there is something going on with my hormones here, or other aspects of my health today that is making this hard, rather than that pressure of, well, I ran at this pace last week, so I have to hit it again this week, or I lifted those dumbbells last week, so I have to hit them again this week. Because I think we do put a lot of pressure on ourselves to just show up day in, day out as the same.
Yeah, I completely agree with you. And I think, like, your symptoms absolutely impact how you feel, and so it's going to impact how you exercise. And men or for women, if you've had a rubbish night's sleep, you don't feel as energetic. So there are real effects. But I think one of the not drawbacks, but one of the drawbacks to the research that we have is it's looking at how those hormones impact objective markers of performance.
Yeah.
What it's not looking at is like how we feel, our symptoms, our perception. And I think what I would love to see is more research on that. So for women who really suffer with PMS, I'm hypothesizing that they're going to have an impact on how they perform and how they recover from exercise, because they're not going to be feeling their best.
Yeah. And I always think as well, it's important to just check in with yourself and how you feel. Because if you wake up and you feel great, then who cares what part of your cycle is?
Yeah.
It's like I also wear a Whoop, and I, in the morning, say to myself, like, how do I feel today?
Before checking
my recovery.
Yeah.
Because some days I feel amazing, and then I'm in like the yellow or red, and I think, oh, now I feel rubbish because I've seen that number. So I always check in with myself first.
Yeah.
I read a stat that 84% of girls avoid playing sport when they're on their period, and 50% of girls quit sport altogether when they begin menstruating. What do you make of that?
I mean, first of all, it's really sad, because that just shouldn't be the case. But I think that happens for multiple reasons. There's still this like long-standing myth, and I don't know what it was like for you when you were at school, that like you just don't exercise during your period.
Yeah.
Some people just use that as an excuse, but also some people genuinely believe that it's not good for them. So I think there's that. Also, as a girl who used to play football and have to wear white shorts, I vividly remember, and it was one of the first year I ever had my period, that being really difficult for me to navigate, because I didn't know when my cycle was going to come, because it was irregular to begin with. And that would mean sometimes like being on the pitch and you having an accident essentially, or leaking through. So I think we don't have kits that support women in sport and exercise. That goes for older women as well, grown-up women. That's changing now, thankfully. But also I think when it comes to kind of period chats that you have when you're a teenager, it's just, this is a pad, this is what you do with it, your period's going to come, it's painful, use a hot water bowl, get on with it, kind of thing.
Yeah.
It's very limited. There's no education around how you can stay active. And if you feel really rubbish, this is what you need to do. And if you are really struggling, you need to speak to someone about it, and be that a teacher, someone that you trust. So I think we are letting young girls down from their very first period because we're not educating them enough on how to navigate the day-to-day aspects of having a menstrual cycle.
Yeah. I mean, I remember being in classes at school and coming on your period, and I didn't know what to do, because you actually weren't allowed to leave the classroom to go to the bathroom. But you couldn't just stand up and walk out. You had to put your hand up and say, can I use the bathroom? And I remember a couple of teachers saying to me, like, why do you need to go now? Can't you wait?
Yeah.
And it's just mortifying, isn't it, really?
Yeah.
And I wouldn't have had the guts then to say, no, I'm on my period, I need to go to the bathroom now.
No. Even now, I think the women of our age who've like grown up with that mentality are still hiding tampons up their sleeve, afraid to have those conversations, even around girlfriends. And I think there's a lot we need to do to like dismantle that like fear. But
you're so right. If I walk from my clinic room to the toilet, I will hold my tampon in my hand.
Yeah.
I'm not walking around waving it around. Yeah. Isn't it funny how we just got these like this shame around it?
There's such shame. And I think someone, I don't know if I read this quote or someone said to me, but if men had periods, when you go into any toilet, we would have it fully stocked with period products, and the campaigns around period products would be like really powerful. And yeah, it's wild.
Well, hopefully we have this conversation again in a few years' time. We've made some improvements on that. Many of us, myself included, are familiar with that feeling of being more irritable, anxious, grumpy in the days leading up to our period. And I agree, the week before my period is the worst. How does our mood change across our cycle?
So, surprisingly, not every woman experiences mood changes across their cycle, but most women who do report it in that 1 to 2 weeks before their period. There's 150 different PMS symptoms you can experience, and they can be psychological.
150?
150.
I couldn't list them.
I know, but it's psychological and physical. So you've got your mood changes, but also breast tenderness, cramping, hunger changes, all of that. And then a kind of smaller proportion, but still a very big portion, 20 to 40% experience PMS or premenstrual syndrome, which is basically PMS that's impacting your quality of life. And then a smaller portion, 3 to 8%, experience PMDD, which is termed like more severe PMS, but people with PMDD generally don't like that phraseology because it really doesn't do it a service for what it is. Like, it's a very severe mental health disorder. It's in our DSM-5. It's really debilitating. Some women, unfortunately, attempt suicide, and some women, unfortunately, die by suicide because of PMDD, which is so shocking. But it's just, if you ask anyone on the street right now, if you go outside, I imagine not many people will be able to say, I've heard of that, which is pretty shocking. So while a lot of us get some mood changes that are manageable, and that is because of the hormone fluctuations, we don't fully know why some women get such severe mood changes, because if we test their hormone levels, it seems to be pretty similar to you and I, but it seems they're more sensitive to the change in hormones. And there's a lot of research going into looking at like the differences in neurotransmitters or certain progesterone metabolites in the brain, because at the moment we do have treatment options, but they're not specific to PMDD. It's either the pill or antidepressants or therapy, and in very severe cases they will look at surgery and removing the womb and ovaries, which is crazy, but for some women, they unfortunately, that's their only option. So yeah, I think of all aspects of menstrual health, that's probably the area that we probably get wrong the most.
And it's just wild to me that when we were learning about our menstrual cycle, most of us were just taught to focus on the bleed.
Yeah.
When everything you said, the bleed is actually the least interesting part of the whole cycle.
And for a lot of women, it's actually, unless you've got very painful or heavy periods, some women actually find it a relief once their periods come because the luteal phase has been so difficult. So no two women are the same in terms of how they experience their cycle.
Yeah. Yeah, I would say, and I'm very lucky to say this, I think I welcome my period when it comes.
Yeah.
I'm not thinking, oh goodness, this is going to be a hell few days. I actually agree that the week before is worse. So just touching on this PMDD, how do you differentiate between expected mood variation and something that actually needs medical input like PMDD?
Yeah, that's a good point. So with PMS and PMDD, compared to depression and anxiety, it's cyclical in nature. So it comes on in the 1 to 2 weeks before your period, and it should improve or get better when your period arrives. If it's your mood is so severe that it's impacting your quality of life in any way, your relationships, your ability to work, you're finding that you're very tearful, your mood is very low, you're very angry, or it's impacting things like your ability to sleep, your appetite changes, and that could be high or low, they're signs that you should go speak to someone. Your mood might change before your period, but if it's consistently happening every month and you feel like how women with PMDD have described it to me is they get basically two good weeks of the month and the other 2 are hell. So if that's what you're experiencing, if you're listening and that sounds like you, that is a really big sign that you should go speak to someone.
Thank you for that. Why do I sometimes look at myself in the mirror and hate what I see?
I actually found this research really interesting on body image because
Me too.
Yeah, it's our hormones basically trick us into thinking we look different or we look worse in our luteal phase, which is so interesting. And it's so wild how it's a universal experience for women. The really interesting part is while we perceive ourselves to look different physically, and that's generally we perceive we look worse in our luteal phase, lots of research shows that when we actually do objective measures, we've not changed at all. So while we look in the mirror and we feel like we look worse, we haven't changed. The caveat to that is some women do find water fluctuates during that time, so they might gain a bit more water, or they might feel a bit more bloated if they're having issues like constipation or anything like that. So you might physically feel a little bit different in your clothes, but you're not suddenly gaining weight. You've not suddenly changed your face overnight, but it feels like that. Body image research shows that if we work on our body image, i.e. work on positive body image, and that is focusing on what our body can do, not on how it looks. And that doesn't mean you have to love your body, because for some people that can be quite a big jump, but just appreciating it for what it does, appreciating what your body goes through every month, how it can carry you in a 10K race or through a class or whatever it might be. That can be a really effective way at improving your relationship with your menstrual cycle as well. So try not to focus too much on your body. I know it can be really difficult, but things like body checking, weighing yourself, those practices could actually make things feel worse.
I wonder if the same applies to how attracted to your partner you are.
I know.
Like, do you see your partner in different ways throughout when your hormones are at different levels?
Surely
you would think around the time of ovulation, there's something going on that makes them look more attractive to you.
Yeah, there's some research that women dress differently around ovulation. There's not loads of research, but that we choose sexier clothes around ovulation. So that's probably tied in with that.
Love it. For lots of women listening, they will be on contraception. Do these same fluctuations in appetite, mood, energy, performance still occur when we're on hormonal contraception?
It depends, is the big answer. So when you're taking hormonal contraception, you no longer have a natural cycle, and you have hormones which replace that but are generally very steady. And most of them, not all of them, will stop ovulation. And it's really ovulation that's dictating a lot of these hormonal fluctuations. So you will generally feel different, but we do still see changes to things like appetite, sometimes body weight, sometimes mood, sometimes skin. So I think it's worth still tracking your cycle and tracking those changes, but it's unlikely it will be the same as how you felt when you were on, or when you were on nothing, or one of your friends who is on a different type of contraception. Like, for example, with the Mirena coil, some women ovulate on it, not all women do. And so you might find you're getting some symptoms coming through. So the short answer is it really depends on what type you're on. But it's not in your head if you're still feeling like you're getting some PMS symptoms or changes and, your breasts are fluctuating. That can be normal as well.
Great to hear. There's a real hormonophobia going on at the moment, and there is a dark corner of TikTok and social media in general that are absolutely fear-mongering about the contraceptive pill. Let's get into pill talk. Does the pill really make us fat and cause depression?
Pill and hormonophobia is wild at the moment. And I think it's kind of gone one of two ways. And we've maybe veered into the area where like everyone's very anti-pill right now.
Yeah.
And I find if I ever stick up for the pill, I'm like told that I'm big pharma or like trying to push pills down people's throat. I'm not paid by any pharmaceutical company. And I don't believe that the pill is the right thing for everyone. I think it's such an individual choice. And for some women, they feel awful on it and it, impacts their mood, their libido, their skin, and they feel better off it. For some women, the only way they can function is when they're on the pill because they've debilitating periods or whatever it might be. So I think it's such an individual choice. Do I think we need to be giving women more information before they go on the pill? Absolutely. They need more counselling. They need to understand what the risks are and the potential side effects. And we absolutely need more research and more options for hormonal contraception in general and ideally male forms of contraception. So I think both things can be true. The pill has a place. I don't think it's the way people paint it as it has no place and it only causes harm is a very, very extreme opinion. And I personally think for some people, it can be a really fantastic choice.
I think a lot of people's concern is because for many of us, you just get put on the pill at 16, 17, and then you don't really know what your cycle is like off it.
Yes.
And then you come off it at quite a vulnerable time in your life when maybe you want to think about conceiving. And then suddenly it's the time when you're becoming cycle aware.
Yeah, I agree with you. And I do think that in a lot of cases, the pill can be given a bit willy-nilly. I know when I first got the pill, I think I basically just said to my mum I had really bad skin, which I didn't really, but all of my friends were going on the pill and I felt like I wanted to be, part of that group. And I was given it quite, without much counselling, without, much advice there. And I think for a lot of 16-year-olds, 17-year-olds, they might go on it because of skin or contraception or whatever it might be, painful periods, without really understanding why. If someone has very painful periods as a teenager, we really want to be ruling out other causes for that pain than just assuming that they need to be going on the pill. But I think what you've mentioned really highlights why the pill is an issue for some people, because when you're on it, you could develop other conditions, be that, PCOS, endometriosis. When you come off it, you're suddenly experiencing your true natural cycle for the first time, and it can feel like the pill caused that.
Yeah.
We don't have direct evidence that the pill can cause those conditions, but it might mask that those symptoms were there in the first place.
If someone has been on the pill for decades, I have been on it since I was 17, so that's frightening. What should we expect when we come off the pill?
Really good question. First of all, the hormones leave your body really quickly. So we generally say that you're fertile from stopping it, but it might take up to 3 months for your cycle to come back. That said, for a lot of women, it does take a lot longer. You'll still see on the NHS website, it says 3 months, but from experience, for a lot of women, it takes longer. If it's taking more than 6 months, go speak to your GP, because again, something else might have been going on when you're on the pill and the pill was masking that. Now, depending on the type of formulation, the type of pill you're on, you can experience different effects. So with the combined pill, for example, women typically, not all women, will find that their skin is better and their hair is better. If that's the case for you, you might find that when you come off, they change a little bit. Not with everyone.
My hair might not be bouncy anymore.
I think it still will be. It's typically if you were acne prone before that, that you might find that comes back. The opposite is true of progesterone type pills. Usually they can trigger worse skin, not for everyone. So if you're on the pill, don't panic if you have good skin. But if you come off it, you might find your skin improves. The same is true of things like libido, mood. With mood, for example, it's one of the most common reasons women cite coming off the pill, because their mood is bad. But actually, when we look at the research, the pill can improve mood for a lot of women as well. So I don't think we can say that the pill harms everyone's mood or causes depression. But the highest risk for low mood related to the pill is when it's started in adolescence. So we need to be a bit more cautious with when we're prescribing it in teenagers, counseling parents and teenagers on that. And you know, with libido, some women say the pill absolutely squashed my sex drive. For other women, it improves it because they feel more relaxed knowing they're not going to get pregnant. So it's such a, like, it really depends on how you feel. But I think if you are planning to get pregnant, give yourself at least 3 months, if not more, before coming off the pill, so you can figure out what your natural cycle is. How long is it? Am I ovulating? And also take your folic acid before coming off, so you can give yourself that 3 month before trying to conceive.
For many women who were put on the pill for hormonal contraception for gynecological reasons, they can feel a bit frustrated because, like you said, it can just mask the symptoms. So it's a management for their symptoms, but they don't always feel like they've been offered a clear diagnosis. What do you want to say to them?
I sort of alluded to it in that the pill can be helpful for managing certain conditions. And so it will be used in certain situations like endometriosis and period pain, because it can help manage pain in that way and bleeding. It'll also be used in cases of PMOS or PCOS by helping to give you that regular bleed, which is not a period, but it's a regular bleed. And that's important to keep the womb lining nice and thin. And if you have acne and excess hair growth from PMOS, the pill can be helpful at reducing that. So it has its place. Where the issue I personally feel is when women are given the pill, there's no explanation as to why this might help them. And the reason behind prescribing it. It's just, I'm giving you the pill. And it can feel like they're just putting a Band-Aid on a problem, but not solving the underlying issue. Now, if they're not looking into why you're having those troublesome symptoms in the first place, I think that's an issue. First of all, we should be exploring why they're having painful periods, irregular periods, and then looking at the pill as an option once we have a diagnosis. And also, I think sitting down and saying, the pill is one option, here are your other options. And I think that often never comes.
Tracking a cycle wasn't a thing back in the day. I think it's great that resources like your book, Not Just a Period, now available for people to read this in a way that they need to hear this, whether you start contraception or not. You've mentioned PCOS and PMOS.
Yes.
Shall we go into that?
I'm still getting used to using it because PCOS is the old name, polycystic ovary syndrome. PMOS is the new name as of 4 weeks ago. And that's polyendocrine metabolic ovarian syndrome. And so this name change is like a big moment in medicine and women's health, because we don't normally change names unless we absolutely have to. But the old name was considered quite problematic because it assumed that everything was centered around the ovaries. It assumed that you had to have polycystic ovaries to have the condition, which you don't. And even if you have polycystic ovaries, you don't necessarily have PCOS or PMOS. This new name change, polyendocrine means multiple hormones, metabolic means your metabolism, so your blood sugar, your cardiovascular health is all involved. Ovarian acknowledges your ovaries are still an important part of your reproductive health, and syndrome means there's multiple parts to this. So this new name change, I think, is a positive thing, because I personally have a PMOS diagnosis, and when you get diagnosed, the focus is just on your fertility. So the kind of party line when you go to your gynecologist is just go on the pill or just come back when you want to get pregnant. And for a lot of women, that's quite frustrating, because maybe they're not thinking about babies now or ever. And also, what else can I do in the meantime? And we've, for a long time, very much neglected the kind of metabolic and cardiovascular risk. So you've got a higher risk of type 2 diabetes and cardiovascular disease with PMOS. And if you look at the NICE guidelines, which have been around for a long time, they're not new, it does stipulate that when you get your diagnosis, GPs should be assessing glycemic status, so checking blood sugar with what we use, a HbA1c, and also checking cholesterol levels, checking blood pressure, asking about family risk factors. And I can tell you that is not happening. Maybe some very good GPs, but whenever I do nutrition consults in PMOS, most women have never had that conversation with their GP. I think that will change now with the new name change, because, even if you're not thinking about fertility, PMOS can impact your hair and your skin. So a lot of women get excess hair growth, acne, depression, anxiety is very common in women with PMOS, insulin resistance, weight gain, difficulty losing weight. So many issues beyond whether you want to have babies or not.
I feel like it's a real full circle moment with where this conversation started, because at the beginning we touched on how women's health is often seen to be reproductive health.
Yeah.
Whereas actually now this name change shows us that this is a condition that occurs in women, but is actually full body, and it shows that our physiology is entirely different to a man's.
Yeah.
So I think it's a great step for medicine and women's health. I agree. I thought we could do a myth-busting quickfire of things I've seen on social media. So number 1, women have higher pain thresholds than men.
Myth, false.
You can't get pregnant if you're on your period.
So you technically can. It would be very hard, but because the sperm can survive for 5 days in the reproductive tract, if you had a very short cycle, technically you could.
Interesting. Women's cycles sync up if they live together.
This is a myth, and people hate when I say that.
Yeah.
I did a post about this on social media and some people were like, I just refuse to believe you because it happens to me. And I also used to believe it because it feels like it happens.
Yeah.
But it's just like the law of odds. It's just because if you have enough women and you have your period 1 out of 4 weeks of a month, naturally at some point you're going to overlap. But when we've done research, there doesn't seem to be any evidence to say that women sync up their cycles. I'm really sorry to say that.
Last week thought that I had synced with my dog Ruby.
Oh, really?
Now I know that's not truly possible. Seed cycling can balance your hormones.
Another one that is unfortunately a myth, and people don't love that news either. I think the thing to say is we don't have strong, good evidence that it's helpful. There's some anecdotal evidence, and people sometimes feel better for seed cycling. And for anyone who doesn't know what that is, it's basically having different seeds at different weeks of your cycle. Seeds in general are really healthy, and there are, particular nutrients in them like zinc and selenium that can be really beneficial for reproductive health. So I think include seeds in your diet. You don't need to stress about having certain seeds at certain weeks unless that's something you enjoy.
Yeah.
Personally, it's too much hassle for me.
I just have a big jar. They all get shoved in the same jar and eat that all month round. Sharks will attack me if I go swimming on my period.
Another one that's a myth. There is no evidence, but it's something that I used to fear when I was younger.
I used to fear that as well. I wouldn't get in the sea if I was on my period. I'll die if I leave a tampon in too long.
So this is a myth, but with a caution. I think something that is also not common knowledge is you shouldn't leave in your tampon longer than 8 hours. We generally say 4 to 8 hours is the sweet spot. And that is because it could potentially increase the risk of toxic shock syndrome, which is a very severe infection. It's quite rare. So potentially it could lead to harm, but it's once you're changing every 8 hours, you should be fine.
But are you really going to bed and setting an alarm after 8 hours to change your tampon?
You should be. I guess most people aren't sleeping 8 hours.
Oh, I'm sleeping 8 hours.
I don't know.
I'm chasing that green recovery.
You are.
I wouldn't set an alarm to change my tampon though.
Well, if it's going to be 8 hours, 30 minutes, it's not going to make a big difference. That's it. But I'm personally period pants for bed because it's much more comfortable.
Interesting. I have to try. The pill causes infertility.
False. As we said, your fertility should return, although if you have developed a condition in the years that you've been on the pill, like endometriosis or PMOS, both of them can impact your fertility and chances of conceiving. And so indirectly, it might feel like it's impacted you, but it doesn't have a direct impact on your fertility.
Interesting. Women can often feel dismissed and not really listened to when they go to their doctors. It really depends on which GP you get. What language and information would you suggest that they use to advocate for themselves effectively?
I think it's really helpful going in there after doing some reading. And I don't mean Dr. Google, but read a book. If you follow a women's health doctor online that you know are qualified, getting information from reputable sources so that you're going in there armed with some education. We love a symptom diary. Track your cycle so you've got like the information there. It's always really hard when you go into a doctor's office. I find it even myself when I'm the patient to remember everything, and you get a bit flustered. You get a bit flustered. And I think documenting what you're experiencing and really emphasizing how it's impacting your quality of life. I think that's a really big key thing. If you're missing time off work, come in and tell us how many days off work you've missed. Those things are really important. And don't feel like you need to downplay your symptoms, because you don't have to, and you're not, being an inconvenience. While I hate that we have to have these conversations, or like how women advocate for themselves, I think also it can be quite helpful if you have someone with you, because if you're getting a lot of information, it can be helpful for someone to remember that, or just be there to like help you articulate what you need to. Sometimes I've had like people who have just said like, oh, my sister is on the phone, and they've like had their a phone call going while we're having a conversation. And I think that's just helpful for them to like have someone else to like ask a question. Yeah. And you're well within your rights to do that.
Yeah. I have loads of patients that's obviously not a women's health clinic, but their partner will say, that does really affect them. Yeah. Or, oh, I think you're downplaying that a little bit. I think I think the pandemic's made this worse, because people are really worried about bothering the doctor.
Yeah, that's it.
Whereas actually on an individual level, there's obviously a problem with GP pressures, but on an individual level, I don't think people need to worry about that.
No, I don't think so. And like in the grand scheme of things, you've got 10 minutes. So like you want to make the most of those 10 minutes. So go in with what you have to say. And like if you need to bring someone, you need to bring someone. It's not an issue. If you feel like you're literally being pushed away and a condition or a symptom is really impacting your quality of life, you can ask to see another GP within the practice.
Yeah, absolutely. I think that's great advice. Thank you. Dr. Hazel Wallace, what is your vision of health?
Ooh, that is such a good question. I think just being healthy enough that you're independent and able to enjoy life. Like that's the vision I see for myself. I want to be fit and healthy, that even when I'm older, I can go for a run, I can go out with my friends, I can travel. I see it as like full body health and the ability to like make the most of your life.
Yeah, I love that answer. I think we talk so much about mortality and lifespan, and we don't focus enough on health span.
Yeah.
So important. Thank you.
Thank you so much for listening to Vision of Health. I hope this episode has helped you feel a little more informed and empowered, and given you some realistic takeaways that you can apply to your own life to help you get clearer on your own vision of health. If you enjoyed this episode, I'd really appreciate it if you left a review, subscribed to the channel, and shared this episode with someone who might enjoy it too. It genuinely helps support the podcast, and it allows us to keep having these conversations. And as always, thank you for being part of the Vision of Health community. I'll see you in the next episode.